Hello, this is Dr. Bouvier with Dr. New. You've come to learn a little bit more on another clinical pearl on primary care practice. And today we've got a friend here stepped on a nail, almost drew it through your foot completely. Went to the emergency department, started a couple of antibiotics, and the swelling and redness is actually getting worse. He was on Cipro and amoxicillin, and I don't know if you can see it too well with the camera, but this foot is reddened in this area, and his foot is probably 3 times more swollen. And he's tender in the top of his foot, even though the puncture wound is over here in the bottom. This is a very common area to have the puncture wound. Now, if you think what happens is you've got the shoe, so you've got the puncture wound is pushing a plug of shoe, of sock, of skin up into the foot, and then the nail comes out and leaves that debris in there. It's really good when your foot bleeds a lot, because a lot of times it'll bleed and push all that debris out, but many times it gets caught in the foot. And you have to go fishing for that sometimes, and this is a classic example of having a major problem here. So when you consider these pieces, a lot of times I'd like you to remember that we use Bactrim many times, because that's one of the only drugs, a very good drug to hit community-acquired MRSA, and that's a good drug to use. So that's one we use a lot. Rarely ever use Keflex, hardly ever works. Cipro and amoxicillin is a good idea to get the anaerobic coverage, but this is actually getting worse, so clinically it's not getting better. We did an ultrasound on him today. They didn't really see anything but the swelling, but I can feel it's hot, thick. So we're going to get a CAT scan of his foot, looking for the debris, because I don't want to have to open this up if we don't have to. It's a very difficult surgery, and you have to find a good surgeon to open it up. Depending on what we find on the CAT scan, I guess we'll find out. The 2 clinical pearls I want you to take home here is, number 1, understand that the plug of material could stay down there, and sometimes you may have to go chasing after it. And the second clinical pearl is, follow this closely. Every day, even if you have to, certainly every other day, and then inform patients that if it starts getting red and ugly and swollen, then you really need to go back to your primary care doctor or come back and reassess this clinically. Tetanus shot, antibiotics was good, but it's just not working, so that's why we're changing the antibiotic. Again, this is Dr. Robert Bouvier with Dr. New and another clinical pearl about puncture wounds in the foot.